Hey, Dr. Ferguson here with The Stem Cell Pro. I wanted to create a quick little video to help you guys understand what to expect after a treatment. So let's assume, obviously, we're not really getting treatment today, but let's assume you did, that you got treatment today. Now you want to know what to expect and what's going to happen. So the first thing I'll tell you is everyone that comes in, I explain that we don't expect miracle results the very next day. It does take a little bit of time. And so when patients come in, the first probably 2 weeks, I expect to say, hey, you probably might think that you wasted your money, that you're not seeing much results. I don't get excited or disappointed the first 2 weeks, okay? So for 2 weeks, you might think nothing happened. Now, somewhere between week 2 and about week 6 is where we'll start having some good days. I kind of explain it like a question mark. Like you start thinking, am I feeling a little bit better? I got out of the chair a little easier. I got in and out of my car a little bit easier, but you still have some bad days mixed in there. So it's kind of that question mark. Between week 6 and about week 12 is where all the magic happens. Now, again, if you understand how regenerative medicine works, is we're trying to help your body repair itself. So we're not masking the pain. We're not going to get miracle results the very next day. And so it takes some time for that body to heal. So it takes literally about 3 to 4 months to get the best results. And I've had patients that took up to as long as 5 months. After 3 or 4 months, I didn't think that we're going to get the best results. And then one day they called and said, hey, I haven't had any pain at all for the last couple weeks. And it took a few months. So just know that the average patients, they'll start feeling differences within about that first 2 to 3 weeks and then slowly get better and better. So the other thing I kind of want to make sure that we cover is expectations on what you should and shouldn't do after a treatment. So the big thing is try to avoid NSAIDs or non-steroidal anti-inflammatories, anything that reduces inflammation. So your Advil, your ibuprofen, those type of things. And the reason that is important is because we want the stem cells to know where to go. Stem cells are attracted to inflammation. So let's say you got a bad back or a bad knee and it's inflamed. If we knock that down with ibuprofen, those stem cells don't know where to go. So if we avoid that, it's better. The other thing is I tell people, try to not do any new activities, no workouts, no boot camps, nothing new for that first probably about 48 hours. If you've been doing it, let's say you have been doing boot camp or a workout, right, prior to the treatment, I would wait 2 days. And then 2 days later, 48 hours after treatment, you're back to normal activities. So those are the big common questions people want to know is how does the results progress and what can and can't do after treatment. Those are the big ones. To learn more, to get more specific on your injuries and what you're dealing with, click the link below. Schedule an appointment. Let's get you in. Let's go over all that information. I look forward to meeting you and helping you understand how stem cell therapy may be the right fit for you.